Good morning, good afternoon, folks. Welcome to this space. My name is Shweta Murthy. I'm the research director at Race Forward, one of the co-hosts of this event. As folks come in and get situated in the space, we invite you all to use the chat to introduce yourself. And in particular, we are dropping a link called nativeland.ca in the chat. Please use that link to research, if you don't know already, which native lands you are calling in from, and please share with us in the chat where you're calling in from. We at Race Forward take our land acknowledgements really seriously. We, as a racial justice organization striving for the establishment of a multiracial democracy, see ourselves as very much a part of the indigenous self-determination movement and see ourselves as striving to uplift and emphasize local indigenous struggles and movements in different parts of this settler colonized land. So really invite all of you all to take a moment, if you don't know already, about which lands you're situated on, so that we can both acknowledge who continues to live there, who was displaced from these lands, as well as whose self-determination we are in solidarity with. So I am calling from the lands of Kickapoo, known in current times as Chicago, Illinois. And I'm seeing folks calling in from Lenni Lenape lands, from Tongva, from the Duwamish tribe. Really invite everyone who's logging in to share where they're calling in from. Thank you so much for those who've shared and for those who've gone to the site to take a look. We know that this resource is imperfect as well, and it may be highlighting some tribes that have lived there and some that don't. And we recognize that perfection is a white supremacy culture problem as well. So we recognize mistakes, we recognize imperfection, and we don't let that stop us from, acknowledging where acknowledgements are due.
I'm Erin Hagan. I'm the Deputy Director for Evidence for Action. We are really so pleased that you all are joining us today for this conversation on how to advance racial justice through research. This event is not intended to be a discussion focusing on the pervasive racial health inequities that we know exist in the country. We acknowledge that they exist, and we think we need to be doing something about them. Rather, we really want to have a dialogue with you all about how research can advance racial justice and health equity. And I acknowledge that research is not the sole way that we will achieve racial justice in this country, but we think it does have a role to play. And to that extent, we want to co-create what that looks like with those in the scientific workforce and the community. And to that note, in terms of funding research, Evidence for Action is a national program of the Robert Wood Johnson Foundation. So we act as an extension of the foundation, and we fund research evaluating the impact of interventions on health equity outcomes, which will define all of that a little more for you all in a minute to unpack some of those terms. But for our purposes, we do want to better understand how, as a funder, we can better support racial justice research and through our funding practices, through our calls for proposals, through our principles and our operations, et cetera. So I really do encourage you all to share your feedback with us. And I also want to be clear that we in no way expect that this is a training on how to do this work. We're really thinking that you all of you who are participating today are equally experts in this area, along with the panelists who are speaking today. And so we appreciate your time and expertise and insight in sharing with us your experiences and your recommendations. What you share with us will inform our future calls for proposals, topics, our systems and processes, our criteria, et cetera. And I know I'll let Shweta speak more about her expectations about how this work will help inform, or how this event will help inform Race Forward's work as well. When we started conceptualizing the event, we knew that Race Forward really would be an ideal partner organization because of their longtime commitment to putting racial justice into practice through organizing and advocacy, through their research, their partnerships, and projects like the Government Alliance on Race Equity, also known as GARE. And so I'm so pleased to introduce Race Forward as our co-hosts. Joining me today is Assata Murthy, the research director at Race Forward, who you heard from as we did our native land introductions, as well as Raintree Salk, who's the research manager of the Government Alliance on Race and Equity at Race Forward. So I first want to thank you, Shweta, for being such an incredible thought partner for this event. And I'll turn it to you to do a bit of introduction about yourself and Race Forward.
Thank you, Erin. And yeah, thank you, E4A, Erin, Steph, and so on for being such incredible co-hosts for this event as well, and inviting us to co-host this event with you all. Hi, everyone. Shweta Murthy, she, her, hers, gender pronouns. I'm the research director at Race Forward. For those of you who may not have heard of our organization, Race Forward is a national racial justice organization. Our mission is to catalyze movement building for racial justice, and we do this in partnership with communities, different organizations and sectors such as philanthropy, local government, and we build strategies to advance racial justice in our policies, institutions, and culture. And research is a strategy of our organization to advance racial justice. Our vision is, as I mentioned during the land acknowledgements, is to imagine a just multiracial democratic society free from oppression and exploitation, in which Black, Indigenous, and communities of color can thrive with power and purpose. So as the research director at the organization, I was just really chuffed to kind of come on board to co-host this project, because a lot of my background is in what is known as research justice in the field, which is essentially the praxis of just research as a way of advancing research for justice. And it really recognizes that research has been historically and in current times a tool of oppression and exploitation. Speaking as a citizen of a former British colony, India, definitely sort of felt the intergenerational memory and trauma of the ways in which research and cartography and so on have been used in colonization processes. So really, the work that we are increasingly seeking to do at Race Forward through a research justice approach is to recognize that research has been a colonizing instrument, and therefore for research to be a strategy of racial justice, we need to decolonize research itself. It's not something that we've come up with in a vacuum, of course. We stand on the shoulders of amazing Indigenous, Black, and researchers and activists of color who have really brought to fore the ways in which research needs to be decolonized to be in service of BIPOC communities. So yeah, this felt like a really important space for us to bring up that ethos and approach as we talk about how research can advance health equity in this country. I wanted to pass the mic on to my colleague, Raintree Salk, who can share more about the Government Alliance on Racial Equity and the interest in GARE in being a co-host in this event as well. Raintree?
Good afternoon, everyone. Happy to be here with you all. I'm just going to spend a little bit of time today talking about the Government Alliance on Race and Equity, otherwise known as GARE. It's a joint project of Forward and the UC Berkeley's Othering and Belonging Institute. And GARE is a national network working with over 320 municipal, county, and state governments across the country to advance racial equity. At GARE, we believe developing a network of governments focused on racial equity is critically important to getting different outcomes in the community. Our approach recognizes that to achieve these goals requires the ability to visualize a more just society, It also requires normalizing the concepts of race and racial equity and our ability to talk about them. It also requires us to organize staff and leadership to build organizational capacity and take action, and to operationalize these values into concrete infrastructure, policy, and practice that is measurable. We also work to ensure that government has the access to peer-to-peer learning, our tools, and the sustainable infrastructure to achieve this approach. Data and research play a central role in our approach, most notably as it pertains to understanding racialized impacts of government policy and action and the root causes of disparate community level outcomes. We believe measurement must be take place at two levels. First, to measure the success of specific programmatic and policy changes, and second, to develop baselines, set goals, and measure progress towards community goals. Our visualize, normalize, organize, and operationalize approach is embedded across our member resources and tools, our peer-to-peer learning opportunities, and our capacity building engagements with governments and their employees to institutionalize racial equity work across the breadth and depth of government. I look forward to being a part of the conversation today. We at GARE have a keen interest in continuing to build a better understanding of what interventions best transform government to achieve health equity in our communities. Thank you.
I think we just wanted to make sure that we do a little level setting for everyone about some of the language that we're using. So I'll let you kick us off, Shweta.
Thank you. Yes, as Erin said, we'll just do some quick level setting here. We want to acknowledge that some of the common research terminology is associated with problematic attributes or negative experiences, as I mentioned, as I was contextualizing the research justice approach. So it's important for us to start off by defining a few terms that we'll use regularly in our conversations today. So the way we define research, or I define research as for myself, is based on an anthropologist called Apadores' definition, where he defined research as the capacity to systematically increase the horizons of one's current knowledge in relation to some task, goal, or aspiration. He kind of snidely called it a specialized name for a generalized capacity to make disciplined inquiries into those things we need to know but do not know yet. Erin?
Great. And in terms of the word intervention, because at Evidence for Action, we focus on, as I mentioned, funding evaluations of intervention. That really means pretty much anything where we're trying to purposefully make a change, any action we are taking and attempting to change those outcomes. So that could be a program or a policy or a practice. And then moving on to the definition of evaluation, at both Evidence for Action and the broader Robert Wood Johnson Foundation, we really have sort of embraced the equitable evaluation framework, which has three underlying principles: that evaluative work is in service of and contributes to equity. The production, consumption, and management of evaluation and evaluative work should hold at its core a responsibility to advance progress towards equity. That evaluative work should be designed and implemented in a way that is commensurate with the values underlying equity work. It should be multiculturally valid and oriented toward participant ownership. And that evaluative work should answer critical questions about the effects a strategy has on different populations, and on the underlying systems and drivers of inequity, and the ways in which history and cultural context are tangled up in the structural conditions and change initiative itself. We also share with Race Forward an interest in impacts, evaluating the impacts of interventions. And Shweta, if you want to share a little bit about how we think about impacts.
Yeah, so at Race Forward, we really emphasize impact planning and evaluation. Can speak from sort of personal professional experience of doing a lot of research in communities of color, that folks ask, what's next? What's going to shift from this work, right? And so that's really asking about impact, where we define impact as the fundamental intended or unintended changes occurring in organizations, communities, or systems as a result of project outputs and outcomes. These can be high level and large scale, often involving the work of other stakeholders. And as we all know, to our weary exhaustion, may take years to achieve. And impacts can be new policies, changed practices, new coalitions, new widely used terms, and so on. So like quick example of that is Race Forward's sort of eminent campaign around dropping the I word, where it was a huge narrative campaign to make media organizations and mainstream narrative stop using the word illegal for immigrants, right? And that was definitely part, or a small part, in the way in which the narrative changed to sort of emphasize the word undocumented rather than illegal to define certain immigration status. Kind of going from that, evaluation, planning and evaluation for us means that it should be deeply inclusive of those stakeholders and community. So apologies for kind of rushing through. We want to make sure that we are giving plenty of time to speakers in the panel as well as the breakout sessions. So with that, we'll begin our event today with our fireside chat. I wish there was a fireside, quite literally, but we'll make do. And it's a conversation among a few of your colleagues who I'll introduce to you in a moment. You will be muted during this portion of the event, you as in all the participants, but you will have time to freely discuss more when we head into the small group breakout sessions, after which we will reconvene to share our reflections, questions, and ideas with the larger group. I really want to emphasize, please keep the chat going. That's our only way to know what immediate reflections and comments are coming up, and you all can pretend that we're in a real space and that you're whispering to each other how potent and amazing what somebody's saying is. So really invite you all to use the chat freely. All right, so to introducing the speakers, I'm really excited to introduce to you the people who have agreed to help us kick off our conversation today. Moderating our chat will be Dr. Janice Johnson Dias, Associate Professor of Sociology, President of Grassroots Community Foundation, and E4A National Advisor Committee member, inviting Dr. Dias to turn their video on. We really want to congratulate Janice on the recent publication of her new book, Parent Like It Matters, How to Raise Joyful Change-Making Girls, which offers strategies for making discussions of racism and sexism a daily practice along the path to uncovering your girl's passions and what issues drive her the most. In conversation with her will be Dr. George Ayala, Deputy Director of Alameda County Public Health Department, Dr. Thomas A. LaVeist, Dean and Weatherhead Presidential Chair, School of Public Health and Tropical Medicine in Tulane University, and Dr. Assata Richards, Founding Director of Sankofa Research Institute. Janice, I will now pass it over to you to begin our discussion.
I am so excited to have this conversation. And I'm always delighted when I get invited to be a moderator. It's my favorite, my most favorite thing to do, because that means I just get to ask a bunch of questions, what you all are thinking, but probably are too polite to ask, and questions that are also in my Dr. Assata Richards, if you can pop on screen so that I can see you.
I'm not able to pop. The host is restricting my popping ability.
I am sure they're going to release you any second now. It took them a while.
I worked on that lighting. Okay.
All right. So Dr. LaVeist, I am delighted to have you here. I also, George, I can't see you either. Oh, I saw now. There you are. Okay. Are we all here? Yay. Yeah. All right. Welcome, everyone. And thank you for participating in Evidence for Action. I sit on the National Advisory. And so I know that for us, this is such an honor to be here. So, all right, let's get right into it, right? They asked us to have a conversation. So let's begin with the easy part. So imagine if you had a magic wand and you could rectify all of these things around racial inequity. What would racial equity look like in terms of the way data are collected, the work is being done, and in the decision-making process, right? what would it look like? Let's begin at least starting with a conversation about dreaming out loud. So Dr. LaVeist, what would it look like? What would racial equity look like in the way we collect data, do this work, and make decisions?
Well, thank you for that question. Thank you for putting me on the spot first with that question. I think that it's an interesting question. I think that what would likely change is what data we would be collecting. You know, I think right now a lot of what we collect is designed to document inequities and to with the goal of looking towards ways to intervene on those inequities and to reduce the inequities and ultimately eliminate those inequities. I think that we'd have a very different strategy. We'd be doing different things. We'd be thinking more about maybe more general questions and understanding how things correlate with and predict other things that would be of interest. But I think the issue of inequities wouldn't be as big of an issue for us. So we would not be struggling with what do we mean by race. We wouldn't be struggling with the terminology, I think, that we use and how we describe these issues. I think it would be a lot of that would be different. And it would just be a different environment that we would be in.
All right. So I'm going to come back and probe you on this, but I'm going to let Dr. Richards, you want to go next? What would racial equity look like?
Absolutely. Thank you for the question and the invitation. I would really work with the researchers. I'd start with the researchers, and my magic wand would be an implicit bias training as a prerequisite, just like the IRB, as a prerequisite for working in communities around issues of health and health equity. I would also mandate on that team an equity specialist. That person's job would be to create and give feedback on systems that are equitable, because I think what happens is that despite our best intentions, our training, our years of knowledge, the structures in which we get our education, we don't have a lot of practice in being equitable in terms of the relationships on research projects. So we are creating inequality in the attempt to solve equity. And I would really work on that. And my third wish would be to do capacity building for communities that are collaborating with researchers and exercising power as collaborators in research. Because I think they have years and years of socialization to not sit at that table as an equitable partner, but sit at that table as a recipient of the great research knowledge and practice of the researchers. So I would work on the table, the structure, and the systems to be able to create some data and some processes that attend to the values of equity.
Thank you so much. Dr. Ayala?
Just building on that, I think I have a whole wish list. First, starting with a wish that we had more people of color as principal investigators, leading research projects, a wish that we had more community engaged earlier and throughout the entire research process, not just as low-paid workers or on advisory boards, that we think about power sharing agreements with communities negotiated upfront. For example, agreements that explicitly describe who leads, who gets to own the data, et cetera. We need CBOs paid for their work equitably. We need community-initiated research equally valued as research that's initiated out of academic institutions. We need review panels populated with peers, other people of color, peers who are aligned disciplinarily. We need to take down the tyranny of the randomized control trial as the gold standard for evidence in favor of a diversity of fit for purpose methods. And we need dissemination strategies that are fully funded, not just given a second thought at the end of a grant proposal.
All right, so I love all of your answers and I really appreciate it, but I think that we overstepped one part. And so I just want to take us back a little bit. So when the meeting started, there were several definitions of level setting. right? So before I ask you the next question, could you define for me, and you can take it in whatever order you want to, what does racial equity mean to you? What is your level set definition? So when you enter, whether collecting data, working with communities, supervising faculty and graduate students, what is racial equity? Paint me a picture of how do we know when we have racial equity?
I'll jump in. For me, as a sociologist, it's always attending to the historical oppression and systemic racism or injustice that that group has faced. So in any group, any setting, I always start with the history, right? Because for me to create equity, I've got to pay attention to the structures and the systems that are present. It's like the elephant in the room. So for me, it's addressing those systemic historical practices, policies that have been created the inequity in which I'm trying to deal with them. And then the second part of that is when all groups have the ability to actualize their fullest potential. And that means individuals, that means groups, and most definitely that means communities, right? So being able to actualize your fullest potential is when we have equity in the work that I'm doing.
Oh, so Dr. Richards, let me follow up. So tell me what that looks like on a Tuesday at 3 o'clock in a meeting.
On a Tuesday at 3 o'clock in a meeting, that means that Assata Dr. Richards is not facilitating every meeting. And Assata Dr. Richards is not the one leading and setting the agenda. And what George said, that means that Assata Dr. Richards is there because she's the director of the Sankofa Research Institute, someone that's paying her salary. And if it's 4 o'clock at a meeting, everybody around that table is being compensated equally and fairly for their time, right? And I'm gonna veggie back off of what George said and also say that if Assata's around that table, it's a shared agenda. It's not just what Assata's priorities are from her board or the funder, right? It is what are the issues that are present to that community. So if today is the trial of George Floyd, and I know my community has been impacted by that, then there's some time on the agenda to address the trauma that they're experiencing every day and not just my research priorities, right? So that's a shared value system, equally compensated, and also a shared agenda for what the work we're doing.
Thank you very much. All right, who would like to take?
Yeah, I'd like to add to that. I mean, what I would add to that is that in the community-based research that I've done have been in the community that I'm a part of. So the way I look at it is I don't look at it as the researcher and the community. I look at it as that we are all members of this community. I have this research training. You may not have that training, but you have other important knowledge that you're bringing to the table as well. But this is a table of people who are members of the community that we're studying. I think that's the way what we need to get to ultimately. And that gets back to, George's point about educating, having a more, more diverse set of researchers, which is basically the reason I went into academic administration in the first place, which is to produce more people to do this work. So you need to get people from the community and give them this training so that they have the training to be the researcher, not only to work with the researcher, so that the community voice is imbued into everything that's being done with the new research.
So Dr. LaVeist, let me follow up on that, because in your work, you often speak about racism as a public health threat. And you write about it, you train your students, we read about it a lot because you write so much. And in talking about that, you simultaneously invite us to think about the way we are thinking and talking about race. So define for Okay.
You froze. Oh, okay.
I froze. Okay, so tell me how you're thinking about racism as a public health threat is shaping the way you're thinking about racial equity in the way that you're training students, in the way you're doing your research going forward.
Racism is a threat to humanity, not just to public health. It's a generalized threat, and it threatens all sectors of society, including health. Health is just the outward manifestation of underlying inequities within society. It's just the indicator that we do. You see an unhealthy population, that means you have an unhealthy society. And racism is at the core what makes that society unhealthy. So that's the way I talk about it, that racism is imbued within the society, within the decisions that were made in the past, as well as the decisions that are being made today. And so that's why I try to train them to talk about, think about it. The other thing is that I think when we start talking about racism, it's really important that we define what we mean by racism. Because so often I find that in conversations, we're using a word, but we're not all talking about the same thing. Most people, when you talk about racism, what they're thinking about is bigotry. They're thinking about somebody is doing something to somebody else because they got bad attitudes towards that person or that person's group. But racism is more than that. Clearly, that is a component of it. But frankly, I would argue it's the least important component of racism. There's structural racism, and that term is being used a lot in the media, also without definition. What do we mean by structural racism? It means that we have established policies, and as a result of those policies, we've organized the society in such a way that it produces racially differential outcomes. And under that scenario, it doesn't matter who is running the society. The system is going to produce racially differential outcomes no matter who is in charge of the system. So you have to look at the actual system, and that's what needs to be imagined. And then the final form of racism is internalized racism. This is the one that gets the least amount of attention. And when it does come up, it also comes up in dysfunctional ways, like blaming the victim, for example. But in internalized racism is when the person who is the subject of the racism themselves begin to adopt those negative beliefs. And I would argue that internalized racism is the most important form of racism, because if I can convince you that you are inferior, I don't need to create structures to hold you back. You will do it yourself. So I think first it's really important that we clear that racism operates on different levels, and that the solutions, the way of addressing racism needs to operate on different levels as well. So that was the first part of what I teach my students about racism and how to engage it going forward in their work.
Well, thank you for that. So George, that leads me to my follow-up with you. So you began by saying that it's really critically important that we have racially diverse people at the table in terms of how decisions are made. But if we listen to Dr. LaVeist's point, which says that their internalized racism may also exist among people who hold these beliefs, how do you think about what we can do in terms of achieving racial equity if members of our own group are also embracing philosophies and ideas that are oppressive to our own? Where does representation play a role in terms of racial equity? What are the limits and bounds of representation?
Yeah, when I think about this issue, I often have to reflect on my own experiences, coming to different institutions like academia or public health and finding just one or two people of color in senior leadership positions. And just because we populate those positions with one or two Black and brown people, it doesn't mean that those people understand racism and are operating in the best interest to, really kind of change systems and structures that, are set up to create the inequities that we find across society and across issues. And so, I think we need to demand more of our institutions and really kind of challenge tokenism when we see it. And we have to educate ourselves and our communities, right? That's part of the work in my mind.
All right. And so in terms of having a meaning that will work and allow us to be able to speak the same language, Dr. LaVeist, I ask you, how are you going about the work of training Black and brown scholars in particular to think about issues around equity? Like, what are you saying to them, those who would be future PIs, those who would be...
I think I know where she was going with the question, so I'll try to answer what I think she was going with it. I was really fortunate in my training in that I was trained at University of Michigan for graduate school in a program called the Program for Research on Black Americans. This was developed by James Jackson, a legendary researcher who recently passed away. And what he created was this team of Black researchers at all different levels: faculty members, students, postdocs, undergraduate students, and we were all in there together working on these projects that were all around the health of around African-American issues. That environment, I think, shaped me in ways that in ways that it's hard for me to even express how I was shaped by that experience. So what was done there is that it didn't just tell us, but it showed us in action. It showed us, it created an ethic of collaboration, an ethic of everyone's voice is valuable, an ethic of everyone brings something to the table, even that freshman that is sitting at the table with us has ideas, and that person's ideas need to be incorporated as well and respected. And so that's what I try to do. I try to create an environment like that. I try to train my students to be in an environment where their voice is valued. Now, remember, the people that we're recruiting for this environment are people who are coming from the communities that we're looking to study. So the idea is you bring in people who have an understanding of the community already. They've got their experience, their lived experience that they're bringing to the table, and we're trying to give them the research skills so that they can do the work on questions that are important given their lived experience.
Thank you so much for that. I hope you all can hear me. So I want to take this issue of racial equity and complicate it in the ways that it often doesn't get complicated, which is when we start thinking about the intersections, not just of Black people, but Black women, Black trans community, Black gay folks, right? What happens there in terms of how we're thinking about racial equity? And how that plays out in how research are collected, data are collected, and in terms of decision making. What do we need to do going forward that would expand or be more inclusive in terms of our definitions and our thinkings about racial equity? And anyone is welcome to take that question.
I'll just say that I love this question about representation. And the reason why representation is problematic because it doesn't address and deal with systems, right? And so, I am a sociologist, and as a sociologist, we focus on systems, right? Because we know it is the systems and the structure that really does predict, constrain, and shape behavior. And so for me, it's not about, if we're looking at history and if we're having this sociological imagination, we're seeing the full spectrum of systems and history and oppression and injustice, right? So in any given situation, we're analyzing the structural dynamics. And I want to say that I think communities have a better practice as being horizontal and cooperative than academics and researchers. We're trained in hierarchy. We're beholden to hierarchy. And so I often say, and I'm going to continue to say, there should be someone outside of this internal team helping the group create the systems that address all structural inequality and historic oppression in a group. When you look at the history of that group, you'll be able to ask yourself those questions. Where are people organized? Where are they situated, right? And I think what we've got to stop doing is, I think Einstein was right. You can't solve the problem at the same level in which it was created, right? And so we need some support and help in being able to have a consultant, someone on the team, right, looking at these issues. And so when we set up the research protocol, we set up the processes around decision-making, around compensation, around power dissemination. All of that should be set up in a research project and clearly understood to support us in meeting our goals.
Well, thank you so much for that. Okay, so given that we need to do that, Dr. Ayala, you want to tell us about some of the most promising research that you have seen, or policies or programs that have been done that really demonstrate to us that achieving racial equity is possible?
Sure, I have two examples to share with the group. The first is related to my experience, my short tenure with the public health department, my experience in the COVID-19 response. And as many of you know, in Alameda County, home to Oakland, California, Black and Latinx communities are disproportionately burdened or shoulder disproportionate disease burden. And so we use quite a bit of data to understand that, right? We disaggregate aggregate data by race, ethnicity, and targeted zip code to basically understand where COVID is happening and how hard it's hitting. And so the county has kind of created a community approach to the response. We've leaned into our partnerships with community-based organizations and advocates. We're creating community-based vaccine points of dispensation. So at any given neighborhood where there's high burden, we're popping up in partnership with communities, these pods, which are points of dispensing vaccines. And everyone in the community and everyone in the neighborhood has a role to play, starting with outreach, health education, bringing people awareness about vaccines and options for them, to folks who bring people in and register for vaccines. So there's that. We also kind of created, we use quite a bit inside of the health department, results-based accountability. So we create scorecards that we use internally and that we review monthly to understand where we are and to course correct in terms of the response. If we're doing weaker in some responses, then we know that quickly as we review those data, and we use those data to drive the decisions. So that's the first example. The second example is an example from a project that I did in a previous organization I worked with called Impact Global Action for Gay Men's Health and Rights. It was an advocacy program called Advocacy and Other Community Tactics Project. It was structural intervention to break down the barriers to HIV care for gay, bi men and trans women, which we ran in 6 countries, Burundi, Cameroon, Cote d'Ivoire, Ghana, Zimbabwe, Dominican Republic, and Jamaica. We used the evaluation approach to understand what we were doing with that advocacy intervention. And we used principles-focused evaluation. We used outcomes harvesting to understand whether the intervention was making an impact. We were able to collect 103 outcomes documented from that process. And the way we collect the data is that we train community folks to serve as mystery clients who can kind of show up to clinics and service organizations to try to document systematically their experiences trying to access those services. We train community people in basic ethnographic observation techniques. They collected that information. We, of course, had partnerships with those organizations in advance, so they were willing to have mystery clients come in. And as a result, we use that data to help shape and change policies and practices at the local level in organizations that really had a terrible reputation in communities around access. I raise that as an example because I think this is a kind of intervention that we could use in promoting racial justice here in the United States.
Thank you so much for that. Dr. Richards, talk to us about some of the promising practices that you have seen or programs around racial justice and racial equity.
Well, like Dr. Thomas, one of my I think textbook projects was actually done between the community that I'm a part of, the historic Third Ward, which is the home of George Floyd, for those of you who may not know, and a project that started with MIT CoLab. And I speak to that project because that university partner really came to the historic Third Ward asking us, what was our plans, goals, strategies for revitalizing, preserving, and protecting our neighborhood? And that group of researchers really spent a lot of time, really checking their biases, thinking about what were the best practices that they can bring to create equity in relationships. And then they use a research skill, really promoting and supporting the leadership of the community, right? And making sure that they could use research and knowledge, case studies, data, everything that we needed at our disposal to be able to move forward with our own identified strategies, right? And giving us the support and the resources necessary to test those strategies, right? Document those strategies, right? Make sure that there were strategies that would really address the facing gentrification and displacement of residents, the health issues, right? And research came much later, like primary data collection came much later. The project started in 2015. And so we didn't undertake a comprehensive needs assessment of the neighborhood until 2018, right? We took 3 years because the community didn't want to start with data. They were no way interested in starting with the data collection process, right? They wanted to start with talking about what were we going to do to change this neighborhood, right? And then we walked ourselves back to the data process. And I'll tell you that first work with MIT, so when we started working with the Rice Universities and the University of Houston, we were in positions of power. We understood our power, right? We understood the information and the knowledge that we had, and we could sit at the table with the mayor. We could sit at the table with the county judge. We could sit at the table with any power broker and really speak to the issues and use data and research. And so when we did collect our comprehensive needs assessment, our community is able to use that data, and we are always able to prioritize. These are the things we need to know. This is why. This is for what purposes we need to know that this community, low income, primarily African-American neighborhood, primarily renters, created the first community land trust, the second in the state of Texas, but the want to be the largest in the nation. They also recreated a whole policy around historic preservation in urban communities. The first city in Texas, urban serving city, to get a Texas Main Street designation. And it wasn't about bricks and mortars, it was around African-American history and culture. Changed the whole street to fight against gentrification. Also began to create the first civic club, right? So it wasn't like we need data, the residents needed power. Before they could start a data project, they needed a civic association so that they could speak to the political leaders, which they didn't have, right? So these researchers attended to our structural needs. They did a lot of capacity building. They did a lot of work of the community to say, you're going to have a lot of research opportunities. And when you get those opportunities, we want you to be ready, right? Ready to be partners with academics and be ready to be partners with the next group of MIT researchers that come knocking at your door, because they will come a knocking, right? And so that's a project that's really about the aims of the community. And that long 5 years, and we're still in relationships. The project funding is gone. They're no longer being mandated to do anything, but they check on us, they support us, they make sure they look out for this community when opportunities come around. And so now this is a community of engaged, activated resident leaders who are now not only partners in research, but authors of research.
Thank you so much. You should know that your chat is blowing up. People are very, very excited at this power sharing possibility. Dr. LaVeist, tell us about some promising, research policy programs that really exemplify racial justice.
Yeah, I really like that. I really like that example that we just heard from Texas. I was going to actually talk about something similar to that we did in Baltimore, but I think I want to go in a different direction instead and go back to COVID. So one of my other roles, other than being dean at Tulane, is that I am the co-chair of the governor's task force on COVID-19 and health equity. And when it became clear that we were going to, that the vaccines, that the phase 3 trials, I think this was the first one, Pfizer, was successful, and that we were going to start getting vaccine, we started to plan how we were going to distribute the vaccine. And one of the interesting things is that from day one, before we had a single vial of vaccine, the issue of equity was on the table. We walked in the room, and that's what people were talking about. How do we do this in a way that we do not have inequities and who gets access to the vaccine? There was a lot of work around that. There was a lot of us in there, and we were all talking about strategies. We developed a map. We looked at, we said, okay, if we use a kind of a typical approach to deliver this vaccine through the normal healthcare infrastructure, hospitals, clinics, FQHCs, pharmacies, things like that, we mapped that out and said, okay, the goal was to predict where the inequities would likely be, so that we can then, once we identify where we would expect to find inequities, we would then think of strategies to get into those communities to ensure that we can get the vaccine there, right? So we were thinking about this before we even had a final approval of the vaccines. That early on, the vaccines showed up in Louisiana, and we still had inequities, right? So what was important here was that every single individual involved in this process put equity first, and all of the planning was about equity, but we still produced inequities and still had inequitable outcomes in terms of the distribution of the vaccine. I think what was really important, a really important lesson there is that the problem was structural, and that even though the individuals all came to the table with the right mentality and the right attitude, determined that we were not going to have inequities, it didn't matter who was at the table. You had all the right people at the table. We still produced inequities. It's a structural issue. And I think that shines the light clearly that that's where the issue is. It's the structure. We have organized the society in such a way that it will produce inequities. And it doesn't matter who the individuals are at the table. If you can't find ways to break down that structure and do something totally different, you're going to have inequities. That's a life lesson for me. The other thing I wanted to quickly point out, is going back to, which I think would be good for this group, given this is E4A. Back in 2008, this is when Congress was still working on the Affordable Care Act. And we had this project we were doing where we were looking at a project to calculate the cost, the economic impact of racial and health inequities on the US economy. The goal was, how much does it cost the country to have inequities, right? It costs money to fix them, but it also costs money to maintain the inequities. And we were trying to figure that out. We had a project we were working on. And it was not necessarily to address for the Affordable Care Act, but once we were, and speaking with partners who were on the Hill, it was clear that they were having some difficulty moving enough votes to support some of the equity provisions in the Affordable Care Act, which by the way, most of those provisions were never funded, although they are in the law. So what we said, well, we have this economic burdens project that we're working on. What if we can rush this project through and get it out and get data, get some results to members of Congress, especially mostly Democratic members of Congress, so that they can understand that the reason to pass the Affordable Care Act was more than just the social justice reason. The members who were convinced by social justice were already at the table. We needed to get to the ones where it being the right thing to do wasn't enough. They needed a more of a utilitarian argument, economic argument. We were able to document how much it costs us to have these inequities, and therefore that data helped those members of Congress to move their votes, to be willing to support maintaining the equity provisions in that law, which many of them didn't get funded, but they were still in the law. And that was an example of where research actually did impact public policy and potentially might make a difference.
Can I add, Dr. Janice? I think that, oftentimes, and I love this story because I think if we start with the end point of what we want research to do, right, then I think we better attend ourselves to creating research that's equitable and accessible, right? Researchers often start with the problem. And if you do anything around evaluation, you're low on the totem pole. And we know this, right? We like these theoretical things, these discoveries, what makes us unique, right? Evaluating somebody else's work, we don't even get excited about that, right? And so I think if we attend our mind to our job is about solutions, right? And our job is about understanding that the people who are most impacted by the problem have the best solutions, right? And our job is to use our data and our research to help them validate their experiences or tweak those experiences, modify them, right? I think that's the power of the work. I think too often research is not made very practical, and therefore the people who we need to be involved in it aren't involved in it because it never really connects to the bread and butter and the issues that they really care about. So I think that I'm going back to my magic wand, that my job is I'm like a waitress. I'm the hostess. What can I do to serve you? I don't have a research agenda. My research agenda is the community's research agenda, right? And that's my only job, is to use all that knowledge and all that time away from my family and my loved ones to use those tools as a support. And I want to say, in my experiences, everybody doesn't want to analyze the data. Everybody doesn't want to, fix the survey instrument, right? That's not what they want to do. Like, I don't want to work in the community garden, right? So I don't put all that burden on them. My job is to make sure that they have access to the information, the tools, and the resources necessary to follow their own work. My job is to serve them. And I think researchers should be a servant to the work of communities and not the leader and the authors and the PIs. I think the structural dynamics need to be reworked.
Okay, so I want to pick up on this structural, I hope you can hear me. I want to pick up on this structural issue. So we have heard kind of rumblings in all of your comments regarding structure, and we've heard and repeated the phrase funding that is a part of it, right? And we know, anyone who is here knows that Black and Brown PIs are rare, especially by the NIH standards, and that we often don't get that level of support. We further know that even nonprofits that are led by Black and Brown people are underfunded. We know that funding is low for anyone who is doing work around women, and especially Black women and girls. So we have all of these kinds of financial challenges within the structure that makes racial equity difficult. Right? So what are some of the additional structural barriers we need to address, overcome, or at the very least be aware of as we try to get towards racial equity? Dr. Ayala, you want to take this one?
Yeah, I guess what I would do, and I appreciate the conversation so much and the issues that Dr. LaVeist and Dr. Richards have lifted up in this conversation. We can't talk about, addressing racism without understanding racism as a structural problem, right? And as I reflect on the COVID-19 pandemic as it happened in Black and Brown communities here in Alameda County, it's one thing to come to the response with a health equity lens. That only permits you to see, right? It's another thing to really try to fix what set us up for really kind of a devastating impact, particularly among Latinx communities who represent 50% of the COVID-19 cases in the county. And so, we have to get better at, when we talk about racism, talking about class and economics, right? Talking about, the housing costs, right? And homelessness and housing instability and food insecurity. All of those things need to be addressed, because if we don't address them, we end up in situations where, health disproportionately impacts our communities. But we're not very good at talking in a nuanced way about class in relationship to racism.
Thank you so much. So, as a political and urban sociologist, definitely class is right up my own alley. And I know that we are often thinking about ways to address the people whom we have the closest contact to. Right? If it is community members, we're doing stuff there. If it's graduate student and faculty, we're doing stuff there. But I want, in these kind of final closing minutes, Dr. LaVeist, Dr. Richards, can you talk to me about what are some of the structural low-hanging fruits that we can start to kind of move away, restructure, remove, in terms of the things that stand in our way to achieving racial equity?
I think, using this example of the work around health and research and equity, I think what Dr. George said, I think funders need to start funding the planning process that gets us to research projects, right? We need to fund that relationship time, right? We need to really invest in helping communities decide if they want to be part of projects, incentivizing researchers, starting with the relationship building. Too often we bake the cake in the lab, right? And then we bring it to communities and say, how does it taste, right? And we do that because there's really no time, there's a lack of resources for that. No one is compensating us or anybody for that work of really being intentional about the systems. Because in the relationship building time and that capacity time, we can be talking about who's making what decisions, right? What are already the inequitable strategies? So in my neighborhood, that's African-American predominantly, you're right, class is the #1 issue. I always say, we're not afraid that it won't be any Black people here, but we're afraid of it won't be any poor people here or working class people here, right? And so many people, if you're not attending to those structural pieces and thinking about that in the context in which we're setting up projects, then we're not really breaking down these inequalities, we're recreating them, right? And I do think in communities, and that's why I love the work that I do, because I do think in communities, we have the opportunity to create structural powers that can shape cities, and cities can shape states, right? If you say, where do we start doing this work, right? We often romanticize ourselves and start with individuals. Hey, that work of individuals, the micro work is important, but what about the macro work, right? What about supporting communities? And now what we're doing in Houston is creating an alliance of historic African-American communities to come up with policy agendas, right? We are putting our money and our resources into the communities which can support the individuals when we go away, right? So if we invest in communities fundamentally with the core understanding in an explicit way in which those communities are supporting residents, not just any residents, right? Historically excluded groups of residents, right? I think that kind of attention to this work is important. And my final thing is that, you know, I love what Dr. Thomas talked about University of Michigan, because one of my favorite learnings all summers was at University of Michigan. And then my favorite learning was hierarchical multi-level analysis, right? When you specified the complexity to which this society operates, right? And understanding that we must specify and measure and have predictors on every level of this phenomena, right? And that's the type of intentionality we have to do to our work, is on every level of the work if we're going to address systemic racism.
Thank you so much. All right, Dr. LaVeist, what are some of the low-hanging structural fruits?
Okay, so you asked initially you asked the question in terms of academia, and then broadly I'm going to say something quickly about each within academia and then outside of academia. But I wanted to just respond really quickly to something that Dr. Richards just said about the hierarchical modeling that class that she took. And with that, the way I read that, what she did was she focused on on excellence. The bottom line is you need to learn as a researcher, you need to learn a wide variety of methods and techniques because of the complexity of what we study. This topic is not the topic for the second-rate researcher. It's the topic for people that have the methodological skills to be able to deal with this complexity. So I tell my students all the time, you say you're a qualitative researcher, you say you're a quantitative researcher. I say that means that both of you are just incomplete researchers. I don't think that there should not be a thing called a qualitative researcher or a quantitative researcher. These are all just tools. And to be a quantitative researcher only is to be a guy who knows how to use a hammer. To be a qualitative researcher only is a person who knows how to use a wrench. But sometimes you don't need a wrench. Sometimes you need a hammer. Sometimes you don't need a hammer. Sometimes you need a wrench. You need to be able to do all of it, all of it. And so I refuse to allow any of my students to call themselves qualitative researchers or quantitative researchers. You need to learn all the methods. They're all valuable. They're all necessary. There are questions that cannot be addressed with quantitative methods, and there are questions that cannot be addressed with qualitative methods. And you got to learn to use all of the methods and techniques and learn it all. That's the first thing. The second point I want to make is I assume that there are some academics listening in here. We need to get past this idea of academic administration being the dark side. Universities are much more than places to learn and teach and do research. They are, in the case of my university, the largest employer in the city of New Orleans. Okay, so if you put yourself into a position where you get to control the distribution and allocation of resources at an institution like a university, you can do a lot to move the needle for the communities you care about. One example, one of the things that I worked on here was getting the university to open a bank account in the local Black-owned community bank here in New Orleans, the bank that gives home loans and business loans in the community here. By simply moving that money into that bank, that produced countless jobs, countless opportunities for people to get mortgages, countless business opportunities to develop the economic status of the community that I'm working in, doing my research in, but also helping to create jobs. We need to get more people that are people of color and allies to go into academic administration so that you can do things like you get to have some say in who gets to go to graduate school. So maybe we don't need the GRE, or maybe we need to find other ways of measuring brilliance and excellence. We need people to be in leadership within academia if we're going to change academia. You're not going to change academia unless you put yourself in a position where you get to set policy. That's my first answer.
That's your lowest hanging fruit. All right.
That's the lowest hanging fruit.
So I want to close this out by doing a thing that is not on E4A's typical action, but we know we're about action, is that we are out of time for this segment, but I ask each of you, and you can go in any order you wish, what is the one, knowing that you are speaking to community researchers, academic researchers, policymakers, graduate students in this population, as well as funders, what is the one ask that you would ask of this population of folks that they can do over the next 24 months to help increase racial equity? What is your ask?
Wow.
See, now everybody's silent. What happened?
I don't always want to be the first one, but I will go. So I would really say that dealing with the economic, I knew as a sociologist, right? When you put household income in that model, the most significant predictor, right? So let's stop playing around the central fact that the economic viability of families and communities predicts a lot of the variance on inequity, right? And that we know if we can move people up economically, then that shifts and shapes so much. Large predetermined housing, health outcomes, we know it, right? And so what I would say is that we take our dollars and really focus on this issue of economic stratification. And I would go one step further and say, we focus on how do we give communities and people who are disproportionately bearing the brunt of health inequities the economic power to determine their lives. One more step, I'm pushing it all the way, and that is really in worker ownership of businesses and economic systems in their economy, in local economies. I cannot emphasize enough that when we impact household income, we change how people eat, we change how they interact with the medical profession, we change the quality of the housing, we change outcomes for their children, and there are too many poor people who are working hard in this country, begging for a raise, begging for a break, breaking for safety, right? And we know that if we could focus on this one issue of the local economy based on giving residents ownership through their own businesses, worker owner cooperatives, which the sociologist, Dr. Nimharp, has shown us the power of that. I fundamentally believe that we can shift the paradigm and move the needle in a way that we have not been able. W.E. Du Bois talked about this in the 1920s. This is the fundamental issue. And I think funders need to focus on the economic stratification of poor people and communities if we want to have some substantial outcomes.
Well, thank you very much. All right, who's up next? You know I'm a good college professor. I will wait 20 seconds and then call on you.
Yeah, I do that too. I'll go next. I was trying not to talk too much. I feel like I've been saying a whole lot. So I feel compelled to point out that I'm a sociologist also, since everyone else didn't put that out there, as is W.B. Du Bois, by the way. So, but I really like that answer Dr. Richards gave. I think she's right there, and I think that the academy is. I want to drill on this point again. The academy can play an important role in that economic development. In most cases, the largest employer in your city is your university, well, at least when you get past Walmart, the university. That means that they're more than just places that teach and learn people, learn and teach people, but this is also a place where economic opportunity exists. There are programs that can be developed within your university. Does your university give email addresses to everybody that works there? The housekeeping staff, do they get email addresses? If you don't have an email and access to the internet, if you can do that through work, at least you have economic opportunity, right? So there are ways that the university can be used to do economic development within communities. And I would say that if I had my one thing that I would say is that people need to be talking to people outside of their sectors. So if you're an academician, you need to be talking to people in communities, particularly the communities that your work focuses on. If you're a community person who is trying to do advocacy for your community, you need to be looking at these other assets in your community, including academics and nonprofit organizations. And I think what needs to happen is dialogue, which is what this program is all about.
Thank you. All right, so you're up.
Just building on my esteemed colleagues, I do, and I'm a clinical psychologist by training, so I come to public health and research from that lens. And so the first thing on my list is we all have to listen. We have to listen to each other, to communities that we serve, and related to that, we have to make space for people of color to step into their leadership. And sometimes that means, holding back, right? Like, keeping our mouths closed so that others have the opportunity to jump in and to take space and to share. We need to also think about COVID as an opportunity, as much as it was a travesty for many of our communities around the country. It is also an opportunity for us to think differently about how we serve, how we come to the work, what we need to do in communities that we know are disproportionately impacted, not only by COVID, but by a whole host of health issues for structural reasons, right? So this is a post-COVID moment where we could think about recovery in a very strategic way and start to play around with initiatives like universal basic income for people who are disenfranchised, right? Or to think differently about housing opportunities and bringing down housing costs so that folks are not forced to live in situations of overcrowding. So those are the kinds of things I think we could do in the next 24 months.
Well, thank you. I thank you. I thank you. I thank you. I thank you for sharing the space with me. I will just summarize what I think are some of the main top line ideas that you have shared with us today. We wanted to begin by asking you about the solutions first, because certainly if we don't have a great sense of where we're trying to go, then it's difficult to get there. So your notions of creating spaces where people are heard, where we are power sharing, where we have a clear understanding that racism is a structural issue, that despite our individual intentions or our individual goodwill, that does not assure that we will achieve racial equity, that racial equity demands attending to those both low-hanging structural issues like funding, and like knowledge, like economic inequality, will get us to be able to get to a system where equity is the structure versus now fighting for equity. And lastly, I would just say that as community leaders in academic spaces, in community spaces, in state-run spaces, is that what you have demonstrated today is that there are opportunities everywhere for all of us with our given skills and talents to be able to advance this work. And then when we are able to see it, then we know that the training that we have participated in, the experiences like these are all well worth it, because we are, in fact, the evidence for the actions that we're trying to see. So thank you again. Thank you again. I turn it over to the group and to Erin, and I appreciate you spending some time with me this afternoon.
Yes, thank you so much, all of you. I especially want to thank you for the passion and optimism you brought to this conversation. It is a topic that certainly does not always engender those emotions. And so I want to appreciate your solutions-oriented framing today. This has been really excellent. There was also a question that came earlier out of the chat that I thought was really interesting, and I saw that Assata answered in the chat, but I might ask you to bring it back to the larger group. So as people are getting comfortable doing that, the question had come from Lauren Supley, and she asked about where and how racial justice might be missing in the methods or frameworks that we're currently using. And she particularly called out those that are intended to be about empowerment and evaluation. And Assata, I thought your answer was, I appreciated in the chat, but if you want to share it more broadly.
Yeah, I love what Dr. Thomas said, because research methods are tools. And they do have some limitations and they have some advantages, right? I do want to say that because of patriarchy, there is this, valuing of quantitative measures over qualitative measures. And oftentimes we say qualitative measures are really about relationship and really connection. Right. And oftentimes we say there are a lot of women researchers that choose that because of those values. But again, research methods are tools. And I like to say, what tool is appropriate for what question, right? That determines the method based on the question. So I think we need to not think about the problem with research is the tools we're using, but the problem with research is the structure. So CBPR, community-based participatory research, there's always this conversation about traditional approaches, right? And we can talk about the values and principles. That's one thing we didn't get into, right? One of the reasons why I'm a CBPR researcher is because of those principles. Those principles are my scorecard, right? I'm always evaluating my projects based on those principles. Was there capacity building? Was there equitable distribution of resources? Was there equity in decision making? Did we do a project that was set by the priorities of the group, right, of the community? And how does a project lead to social action? That's my scorecard, right? If I have not done that, then my project is failing. Not because of the data, we may get great data, but based on the principles which I've subscribed to. So I would say to people, look at the principles. And as we keep saying, the systems and the processes involved in the research project to decide is this equitable or not. Not if you did a survey and collected quantitative data, right? That's not the question. The question, because you can do interviews and still be inequitable. The question is the systems and the processes in which the research is undertaken.
Thank you so much, Assata. I want to invite other questions and comments from the group. Also, you can raise your actual hand since people have their video on if you would like. And I only ask you to do that in case everyone's trying to jump in all at once. Otherwise,
Erin, I can jump in with just a comment. This is
Thanks,
Caroline Wickenberg from the University of California, San Francisco. I was really struck by Dr. Richards' description of her partnerships. And one of the questions that we had in this small group really made me think a lot about the way research funding is structured right now for researchers is, you apply, you don't get money until you've applied and with an existing research question, and you have to have everything figured out, et cetera. There's really no funding to allow you to build the kind of relationship that starts out with just, hey, I'm interested in, this is what I do, can we work together? Is there something we could do together that would be mutually beneficial? And so just something I thought I would throw out to you guys at E4A, anybody else who's a funder on the call, this idea of putting funding out there that is about partnership development, not about figuring out a specific question, but building that trust-based partnership that is required to do real, equitable community-based participatory research, because it takes time. In our small group discussion, it was clear, it takes a lot of time to build trust, because for very justifiably, academic institutions are viewed as not trustworthy in many communities. Anyway, so I'd want to put it out there as a comment and suggestion.
Absolutely. Thank you so much. That came up in our conversation too. And by way of showing that this is intended to really be a group discussion, I don't know if Roberta or Caroline, since you were in my group, I'll put you on the spot a little bit, are interested in sharing anything that we chatted about, just about the importance of spending that time in trust building.
Hi, good afternoon, everyone. This is Roberta. That was the key thing that we just discussed as far as really power sharing, cultivating relationships, but also trust, and rightfully so, in building that trust, recognizing that we're starting from a place of distrust, specifically for larger institutions, and really being able to often build trust for you, even though sometimes they may not even have trust for the institution at large. So just recognizing that, and that does take time. And in academia, one of the things that I find so interesting is, most folks, and when they get more senior towards the end, you'll see them doing more community-based research. But unfortunately, as junior faculty, they're really steered away from doing that, because it does take a lot of time, and you can have some very powerful outcomes, and they're more guided and steered towards doing more quantitative type work. And so it really is sort of like a schism there of what's valued and what's not valued. Even if a question may drive the approach that should be taken, there still is the values, what's valued is very clear. Let's just say that. Within that.
That gets right back to the point I was making earlier about needing for people that are like-minded to put themselves in positions where they can affect policy in academia. Academia needs to be changed, because you got structural problems there too. And until we have people that are concerned about these issues, that are willing to serve as department chairs and deans and so on, we're not going to get this issue resolved. And we're going to continue to have this incentive structure that even if you are a junior faculty member and you really do want to engage with communities in a certain way, you have a disincentive to do it, because you're putting your career at risk. So we need people to, we need that change to occur. And it only occurs when we get people at the table of decision-making who are like-minded.
And I absolutely add quickly that one of the great things that happened with the partnerships is that faculty members designed classes where their students did projects, good, rigorous projects with the community, right? So the faculty got to be with us as an extension of their teaching, right? They designed these really dynamic courses where they were working with us in community. And then the faculty also used it, because I'm a former academic, and I know I didn't say that, but as a community service time, right? And so this was things. And then a third thing is that many of the faculty members live in our neighborhood. So it was like they were coming to their own civic club, right? So they chose to live in a neighborhood where they could embed themselves so that they could build that trust, and they weren't foreign to us, right? They decided the neighborhood to live in based on the fact that they know they wanted to do community-based participatory research. They lived in the community so that they could be a part of the neighborhood.
And then when you're doing that research, you are not working with the community, you are working with your neighbors, because you are also a representative of the community. That was the point I was trying to make earlier.
Yeah, thank you. That is also good. Tammy Fleming, I saw your hand earlier. I'm going to give you the last word if you'd still like to make it just before we wrap up. I know we're getting tight on time.
Yeah, I would say just from earlier, Dr. Assata talked about the planning process, and I'll say from a funder's perspective, we should be pushed as funders in terms of funding that. I believe that the work happens, a lot of the work happens in the relationship building process, and we don't give enough value to that. Because I think if the researchers and community are working together, it helps to reshape or reframe questions, to reshape or reframe the way the research is done, and reframe the interpretation of the research. And I think some of that bubbles up from the community if we have the right sort of planning processes in place. And unfortunately, I think a lot of people give us what they think we want versus making a justification for a planning process that needs to happen when they're partnering with community residents or young people.
Thank you so much for sharing that. I think that you all did such a nice job of capturing the high level takeaways from this event so far that I'm not going to do a recap, especially given how tight we are on time, but I would be remiss not to thank everyone again, especially the participants, as well as Dr. LaVeist, Dr. Richards, and Dr. Ayala, and Dr. Johnson Dias. Also, I want to thank our co-hosts from Race Forward, and Ger and Shweta. I will let you send people off with departure after I just note that there are a number of resources, new calls for proposals that are being released this week and forthcoming. And so through this conversation, as well as through our follow-up survey, we'll drop in the chat a link to all of those resources, one link, all the resources in one place, and follow up with an email. But Shweta, if you would like to close us out.
Yeah, thank you so much to all the speakers and the moderator. I don't see Janice here yet, but maybe she is. And thank you. I had a really wonderful small group breakout session and kind of felt both inspired and frustrated by shared challenges and barriers. Our information, particularly mine and Raintree's, is in the link that was dropped in the chat. As I mentioned, at Race Forward, we're leading a research justice mandate of decolonizing research and spending and capacity building strategies in BIPOC communities. So I know that I'll personally be reaching out to some of you all just to kind of think about collaborations in the future. And yeah, really want to echo that there's a lot of work that universities and funders can do to make this work possible, because it's clear that people who are interested in doing this work, both in academia and outside of it, feel underinvested in and feel that there's a real need for both power sharing and power shifting. So really appreciate the conversation today, and hope you all have a wonderful afternoon, evening, and happy National Vaccination Launch Day.